Welcome back to the Anatomy on Tips YouTube channel. Today we will learn femoral triangle. First, definition of the femoral triangle. Femoral triangle is a triangular depression on the front of the upper one third of the thigh immediately below the inguinal ligament. What does the definition says? Femoral triangle is a triangular depression. First is triangular depression. You can see in the image there is triangular depression on the front of the upper one third of thigh, upper one third front triangular depression below inguinal ligament. These 4 points you have to note. Femoral triangle is a triangular depression on the front of the thigh in the upper one third of the thigh and just below the inguinal ligament. Boundaries of femoral triangle. Lateral boundary of femoral triangle is made by medial border of sartorius muscle. Sartorius muscle form the lateral border of femoral triangle. Medial border of femoral triangle is formed by medial border of adductor magnus muscle. Adductor magnus muscle. Base of the femoral triangle is formed by inguinal ligament. Base is formed by inguinal ligament. And apex of the triangle is formed where medial and lateral border crosses each other. Boundaries of femoral triangle. This is anterior superior. This is anterior superior iliac spine. This is pubic tubercle. This is inguinal ligament. Now sartorius goes like this and adductor magnus like this. This is our femoral triangle. This is lateral side, this is medial side. Laterally it is sartorius, and this is medially adductor magnus. Once more, the boundaries of the femoral triangle. Medial border of sartorius form lateral boundary. Medial border of adductor longus form medial boundary. Inguinal ligament form base, and base is the point where lateral and medial border meet. Roof of the femoral triangle. Roof of the femoral triangle is formed by skin, superficial fascia and deep fascia. Roof of the femoral triangle is formed by skin, superficial fascia and the deep fascia. Superficial fascia of femoral triangle contains superficial inguinal lymph nodes, femoral branch of genitofemoral nerve, superficial branches of femoral artery and branches of ilioinguinal nerve. Superficial inguinal lymph nodes. Superficial fascia contains superficial inguinal lymph nodes, femoral branch of genitofemoral nerve, superficial branches of femoral artery and branches of ilioinguinal nerve. Now the floor of the femoral triangle is formed medially by adductor magnus muscle and pectineus muscle, and laterally the floor is formed by psoas major and the iliacus muscle. This is anterior superior iliac spine, this is pubic tubercle, this is sartorius, this is adductor magnus. This floor is formed by four muscles. This is iliacus, this is psoas major, this is pectineus, and this is adductor magnus muscle. This is floor. In the image you can see the floor of the femoral triangle. Laterally it is formed by iliacus and psoas major, while medially it is formed by pectineus and adductor longus. In the boundaries of the femoral triangle you have to draw this image. First thing you have to show is inguinal ligament. Second thing sartorius. Thirdly you have to show adductor longus, and then the muscles of floor of femoral triangle. These four things you have to compulsory show in the boundaries diagram of boundaries of the femoral triangle. Medial border is formed by the adductor longus, lateral border is formed by the sartorius muscle, base is formed by the inguinal ligament, and the muscles forming floor are iliacus laterally, psoas major, pectineus, and adductor magnus medially. Contents of femoral triangle. Most important point in the femoral triangle, that is contents of the femoral triangle. First is femoral artery, femoral vein, femoral sheath, and nerves, that is femoral nerve, nerve to pectineus, femoral branch of genitofemoral nerve, and lateral cutaneous nerve of thigh. The simple trick to learn all this, that is femoral artery, nerve, vein, that is femoral sheath, most of the content, and then nerve to pectineus, then femoral branch of genitofemoral nerve, and lateral cutaneous nerve of thigh. Deep inguinal lymph nodes. This is the image describing the femoral triangle. Firstly, this is anterior superior iliac spine, then pubic tubercle, here will be pubis, this is pubis, this is femoral sheath, femoral canal, femoral sheath. In this image we can see artery, nerve, and vein, that is femoral artery, femoral nerve, and femoral vein. If we see the relation of the femoral artery, vein, and nerve in femoral triangle, vein, this is lateral side, this is medial side. Vein is medial to artery and artery is medial to nerve. This is very important point. Femoral relation of femoral artery, vein, and nerve in femoral triangle. Medially and lateral, a vein is medial to artery and artery is medial to nerve. This is another diagram for the content of the femoral triangle. First, femoral sheath. Femoral sheath contains femoral vein, then femoral nerve, and femoral artery. This is femoral artery. Adductor longus, which forms the medial border of the femoral triangle. Sartorius, which forms the lateral border of the femoral triangle. Then inguinal ligament, which forms the base of the triangle.